Hi everyone, my name is Katie Wilson and I am currently a registered nurse in the pediatric emergency room. Today we're going to talk about a very controversial topic, and that is the topic of vaccines. So first I'm going to play a quick video for you on vaccines and then we will start to talk.
Vaccines play an important role in protecting your health and the health of your family and community. You may think of vaccination as something only children need, but all adults also need to be vaccinated to protect their health and the health of their loved ones. It's important to get the flu vaccine every single year. Our immune systems weaken and put us at a higher risk for certain diseases like shingles or pneumonia and their complications. Take control of your health by making sure you are up to date on all the vaccines recommended for you.
All right, so why are vaccines such a big deal in the community? Vaccination is a proven tool for controlling and eliminating life-threatening infectious diseases. According to the World Health Organization, vaccines prevent around 2 to 3 million deaths per year. So like I said before, I currently am a nurse in the pediatric emergency room, so this is a topic that I find myself discussing with parents pretty frequently and that I'm very passionate about and I've done a lot of research on. So today we're going to talk about the need for vaccines, the misinformation surrounding vaccines, and the reasons that you should vaccinate. So why do we need vaccines? Vaccines are an effective means of preventing life-threatening illnesses by boosting the body's natural immune response to diseases such as viruses and bacteria. Before vaccines, many children died each year from diseases that vaccines now prevent, such as whooping cough, measles, and polio. So prior to vaccines, the CDC stated that 3 to 4 million children were infected with measles. 100,000 of those children were hospitalized, and 500 of those children died each year. For pertussis, there were 8,000 deaths per year in the U.S., primarily in children. According to the American Academy of Pediatrics, over 1 million infants and young children die annually from pneumococcal and rotavirus diseases, which are both vaccine preventable. Vaccines help to protect the health of our community, and preventable diseases have a costly impact, resulting in doctor's visits, hospitalizations, and premature deaths. So we know the benefits of vaccine. There's plenty of research surrounding the benefits of vaccine. So why is it that there's still such a disconnect between the community and their dislike for vaccines? So the number one reason that I found is misinformation. A lot of times after talking with parents, I found that they educate themselves on the side effects for the vaccine instead of educating themselves or also educating themselves on what they're vaccinating against. So the biggest one is that vaccines cause autism. This couldn't be more wrong. So in 1998, a British physician by the name of Andrew Wakefield published a research article in a journal called The Lancet, and in that research article, he claimed that he found a link between the measles, mumps, and rubella vaccine, the MMR vaccine, and children that showed symptoms of autism after receiving the vaccine. So fast forward to 2010, the same journal, The Lancet, discredited Wakefield's research due to fraudulent results and planned profit motive for him and his foundation. Countless studies have been done after this to try to find the link, and there's been no reputable or relevant evidence to date that have found the link between the MMR vaccine and autism. So another common myth that I hear all the time, especially with the flu vaccine, is that vaccines give you the disease that you are trying to prevent. And this is quite the contrary. So vaccines work by training your immune system to recognize and combat pathogens, and the pathogen being the virus or the bacteria that causes the disease. Certain molecules from the pathogen called antigens, which are in the vaccines, are then injected into the body, which triggers an immune response. This immune response allows you to build up antibodies to protect yourself and fight off the infections in the future. So with the flu vaccine, a lot of people I hear all the time that if you get the flu vaccine, you get the flu. That is not true. The flu vaccine is a live attenuated vaccine, meaning that you do get a live version. It's just weakened. And because it is weakened, it will not spread and cause sickness. A lot of times if you get the flu vaccine and you get sick, it's almost always because you are already exposed to something and your body starts making antibodies towards the flu vaccination and stops fighting off whatever you were already exposed to, so that then takes over. The American Academy of Immunology reported that more than 226,000 people are hospitalized from flu complications each year, with 36,000 of those cases becoming fatal. The next common myth is, I don't need to vaccinate my child because all other children around them are already immune. So this concept is herd immunity, and basically what that means is that these parents feel like they don't have to vaccinate because everyone else is vaccinated. So when there's a large population of community that's vaccinated, this reduces the outbreak. Those unable to receive vaccines are reliable on this type of protection. However, if enough people start relying on this type of immunity, that herd immunity will go away and it will cause disease outbreaks. So now that we've cleared up the myths, let's talk about the reasons that you should vaccinate your child. So vaccine-preventable diseases still have not gone away. The threat still exists. These diseases, other than polio, still exist in some parts of the country or other countries. So the illnesses are brought back into the U.S. by international travelers. Those who are not vaccinated are at a much higher risk of life-threatening illness. The potential risks associated with the disease that vaccines prevent are much greater than the potential risks that are from the vaccines themselves. So, for example, the measles vaccine may cause a mild rash or fever, which is the body's natural immune response. However, if your child gets measles, they can get encephalitis, which is swelling and infection in the brain, and blindness. Or pertussis, the vaccine may cause fever and fussiness, but the illness can cause violent coughing fits, leaving a child gasping for air, and is often fatal for infants. If children aren't vaccinated, they can spread the disease to other children who are too young to be vaccinated, or to people who have weakened immune systems, such as transplant recipients and those with cancer. This can result in long-term complications and even death for vulnerable people. So we don't vaccinate just to protect us or just to protect our children. We vaccinate to protect our grandchildren, their grandchildren, and their grandchildren that come after them. So, for example, our children no longer have to get smallpox shots because the disease no longer exists. So, and if we keep vaccinating against other diseases, the same will be true for them. Vaccinations are one of the safest preventable measures available and are strongly supported by the American Academy of Pediatrics, the American Academy of Family Physicians, and the Center for Disease Control and Prevention. Thank you for your time.